of PCOS. Secondly, being to assess the quality of life of women through the polycystic ovary syndrome questionnaire, PCOS-Q. And thirdly, to embark the new horizon of scope of holistic homeopathic treatment in cases of PCOS. The methods being, this was a prospective experimental study carried out for 12 months of duration on the sample size of 50 cases under the diagnostic criteria of Rotterdam criteria of PCOS, and the investigations being LH and FSH test, fasting plasma glucose test, anti-molar hormone test, free testosterone test, and ultrasonographic test. Inclusion criteria being female between the age of 12 to 35 years of age, all new and pre-diagnosed cases, female with given and informed consents who have been already diagnosed or about to diagnose. Exclusion criteria being female above the age of 35, under the age of 12 years of age, who have been diagnosed with systemic or immunocompromised or chronic diseases, or lactating and pregnant women were excluded, or who have been diagnosed with any other form of cyst. The intervention period was at Sainath Homeopathic Hospital associated with Rajkot Homeopathic Medical College, Parul University. Selection tool being consent form, case taking performa, and PCOS questionnaire. The medicine pulsatilla nigricans at 200 C potency was dispensed every week. Single dose size being 4 to 5 globules of 40 number pills, and Seclec for TDS was given. All the patients were given auxiliary advice of diet, exercise, and lifestyle improvement through nutritionist and dietitian. The data was collected in both hard copy and soft copy. The follow-ups were taken every 15 days, and the dropout cases were those who haven't given minimum of 6 follow-ups or any emergency cases. I have divided all the cases in 5 improvement status: marked improvement, moderate improvement, mild improvement, and no improvement. So here are my results. This was the observation. The majority of the cases I found were between the 20 to 30 years of age. As I mentioned earlier, the late diagnosis is one of the reasons. The secondly being occupation was student. Majority of them were student and homemaker. And majority of the cases having the sedentary lifestyle that was observed. Majority being married compared to unmarried, and bilateral side affection of the ovaries was seen. This is the result of blood investigations which I mentioned earlier. So before and after intervention results according to the age group I have divided. The first one being the LH-FSH ratio before intervention, after intervention. Secondly being fasting glucose level before intervention, after intervention. Thirdly, AMH levels of the group before and after intervention. Fourth being free testosterone test level before and after intervention. And lastly, the investigation of USG, especially for the follicle counts, which I saw the difference before and after intervention. This was the final result. 16 out of 50 cases, 16 cases were cured, 19 being marked improvement, 7 being moderate improvement, 8 being mild improvement, and 2 with no improvement. The PCOS score before and after, the blue one is of before, and the post score is the pink one. This is the overall difference, the before and after, showing the improvement status of 72.49 points. The minimum score was, as I showed, minimum score was 26 and maximum was 182. So, as I said, PCOS being multifactorial disease, having symptoms of irregular menses, insulin resistance, hyperandrogenism. In chronic cases, it may even lead to type 2 diabetes mellitus, further mental health issues, and endometrium cancer, and may lead to infertility, etc. Pulsatilla nigricans plant having the anti-inflammatory, hormonal balancing, anti-cancerous, and antimicrobial property, which give this result of Pulsatilla nigricans being 84% effective in cases of PCOS as per my result. The pre-score and post-score result of the PCOS questionnaire, along with the improvement status of the investigation, proves the efficacy of Pulsatilla nigricans, thereby adding the knowledge to our Materia Medica's 200-year-old proven remedy, polycrust remedy. In conclusion, I would like to say that with the rising prevalence of PCOS, early diagnosis is crucial for the effective management. This evidence-based research underscores the promising result of homeopathy, particularly pulsatile and nigricans, who have demonstrated 84% of effectiveness in treating the PCOS symptoms. These findings highlights the potential scope of homeopathic treatment in cases of PCOS, and also the National Commission of Homeopathy and CCRH have also highlighted the importance of evidence-based research in homeopathy, advocating the further exploration and integration of complementary therapies in clinical practices, enlarge the scope of homeopathy in treating the cases of polycystic ovary syndrome. Lastly, I would like to say empowering women with knowledge about PCOS today will lead to healthier generations tomorrow. I would like to thank Father Muller Homeopathic Medical College for giving me this opportunity and Potentia 24. Thank you.
Thank you, Ms. Hedvi. Judges, please note the time taken by Ms. Hedvi is 7 minutes 16 seconds.
Actually, it was a very good presentation, and
Thank
you have
you, sir.
got good findings also. Now, if you want to take this research forward, you are an undergraduate or postgraduate now?
I'm an intern at
Intern.
Rajkot Homeopathic Medical
Okay,
College.
now you will be going for post-graduation, right?
Yes, I want to
So
do
what
post.
way you can take it forward?
So basically, I have seen that I want to go for infertility cases also along with this, because I have seen infertility cases with who have been diagnosed with PCOS. So majority of the cases were them. So I want to underscore that this is just the beginning. I want to do furthermore exploration under the PCOS topic, because this is about, according to WHO, about 116 million women are suffering from this. In India, out of 10, 8 women are suffering from it.
Yeah, good. Excellent. You can take it forward.
Yes, sir.
And just to tell you, some of our faculty from here,
Yes,
they had done some research on infertility and homeopathic medicines. They got encouraging results. Okay, probably now maybe that research also is getting, might have published. Definitely you can take it forward. What was your sample size?
50 cases I have mentioned in the methods.
How did you
Yes, so basically it was a 1 year duration time. So at the Sainath Homeopathic Hospital, which is associated with my college, the patients I saw were more. So I gave them informed consents. I'm from Gujarat, so of course in Gujarati and English I gave them along with the consent form. Everything was
So before I
informed.
ask questions, you have the answer. Very
Yes,
good.
yes, it
Very good.
was.
Excellent. So next time when you do the study, look at the sample size calculation and other things that, okay, you can add more parameters into your study, more laboratory parameters you have done excellent. Okay. So make it better,
Thank you, sir.
but good study. Thank you.
Thank you, sir.
Interesting study, Hetvi. As you have said, PCOS is a syndrome, and you use the pulsatilla, right? Only pulsatilla was given, or any other drug, allopathy medicine was going on?
Yes, this was checked that the allopathic medicines, the hormone pill and metformin were not given. Only homeopathy was given. This was completely checked.
Okay, and that was the one thing. And another important thing, when we talk of a syndrome, do I understand the pulsatilla has been used as a uh, constitutional remedy in all the cases?
No, it was used according to the symptoms. Means most of the cases which I saw, I found them being matched with the pulsatilla nigricans, and hence I chose that.
Symptoms are of a disease,
Yeah.
right? We in homeopathy prescribe medicine on a entire study of an individual. So, do I understand that it was your sector understanding and given a pulsatilla?
Personally, what I have seen is that most of the cases were being matched as a constitutional remedy. The results which I saw, the cured cases were being matched as a constitutional.
Gynecology was involved, or it was the only homeopathic dispensary has taken care of all the cases? One
Pardon,
question.
I don't.
Either gynec was a part of your research, one question. Second, on what day you have given investigations? Two. And third, in sonography, what you have seen?
In sonography, first thing, I have seen the follicle count difference. So anywhere between 15 to 20 follicles per ovaries, more than that is called as PCOD. Okay, and the other
No, what difference you were able to?
the difference in just a second. Yeah, so here what I have done is all the cases were taken in the follicle count was taken, okay, and according to age group, I divided them. What was the difference? And with the help of statistician, I gave the average of this.
Per
So,
abdominal, which was the sonography?
sorry, I didn't.
Sonography was per abdomen or per vaginal?
No, pelvic organ per abdomen sonography.
Okay. And the investigation was done on which day of a menses?
On the second day of menses, every cases.
ठीक है.
Yeah.
Hi,
Hello, ma'am.
very good presentation.
Thank you,
Very
ma'am.
happy with the data analysis part. Yeah, it's come out very well. I just wanted to ask, why did you choose participants between the age of 12 and 35 years?
Firstly, that it was given guidance from my guide, Dr. Kanan Bhatt ma'am. And secondly, 12 years is almost average of menarche, and so hence I choose that. And 35, because after 35, what the justification which I got was, yeah, after 35, there are not more cases which you can see. More cases will not come up to you that, okay, this is the thing. It may be advanced. It will not come as a form of PCOS. It would be advanced in form of fibroid or anything else. So I kept it till the 12 to 35 years of age.
And how about the exclusion criteria? Have you mentioned something about
Yeah, yeah, I have mentioned. Yeah, the exclusion criteria, the female above the age of 35, under the age of 12, all those cases who have been diagnosed with some other disease, only, this were only pure PCOS cases.
Okay. How about patients, for example, who have fibroids with PCOS?
Yeah, so that I have mentioned this one, the last second. I have not included that, only PCOS cases, only.
Okay, so PCOS only.
Yeah.
Okay. Anything with PCOS plus thyroid? Or
No,
any-
currently I have excluded, and also sir asked that what further I want to do. This is my interest, that I want to research for PCOS with thyroid, because I have find that thyroid is very common thing, hypothyroidism. So
That's it. Thank you. All the best.
thank you.
Let us proceed to the next presentation. I request the presenter, Ms. Asha George, to come on stage. Presenter, your time starts now.
Good afternoon, respected dignitaries of the dais and all the members who have gathered here. I'm Asha George, final year student from Sharda Krishna Homeopathic Medical College, and this is my STSS topic. The topic is effect of homeopathic medicine, colostrum 6X on high-fat diet-induced experimental visitor albino rats. Why the study is needed now is that the incidence of cardiovascular diseases is increasing nowadays, and the major risk factor for getting this disease is due to increased level of lipid level, that is hyperlipidemia, and the rationale of WHO state that a third of ischemic heart disease is determinable to high cholesterol. And moving on to my aim and objectives, the aim is to assess the efficacy of anti-hyperlipidemic activity of colostrinum 6X on high-fat diet-induced albino rats, and to evaluate the anti-hyperlipidemic activity that is within a short duration. And about the methodology, I selected 12 Western and albino rats from the approval of Animal Ethical Clearance certificate. Then these 12 rats were acclimatized for a period of 1 week, and then they were provided with high-fat diet. About the preparation of high-fat diet, I made 75 gram of vanaspati ghee and 25 gram of coconut oil mixed with the normal rat diet, and they were administered in the form of pellets after feed, and that is in the morning and in the evening. Then hyperlipidemia was confirmed using blood lipid profile analysis, and these rats were divided into two groups, that is containing 6 rats each, that is control group and experimental group. Control group were non-medicated, that were provided with normal rat diet, while the experimental group was provided with colostrinum 6X, that is orally, that I have given tablets, 1 or 2 tablets per rat. Then I assess lipid parameters after 1 month, that is I assess total cholesterol, triglyceride, low density lipoprotein and high density lipoprotein, and I analyze the final results using paired sample statistics. This is the picture representation, that the first picture shows administration of the feed, second is administration of medicine, and the third shows taking the blood. This is the result of control group, that is in milligram per deciliter. As you can see, there is no significant reduction in any lipid values of the control group, that is arranged from C1 to C6. I randomly taken the rats having hyperlipidemia. While if we are checking the results of experimental group, we can see due to the shortage of time, I can pick 1 or 2 results. That is, event rat shows 80 milligram per deciliter from 200 milligram per deciliter. Then taking the triglyceride value, we can see 79 got reduced to 45, and LDL value 19 got reduced to 1. Likewise, the values got reduced. And here we can see the p-value of colostrinum group, that is the experimental group, was reduced to 0.05. And I apologize for not mentioning the p-values. Actually, the p-values were 0.045 and 0.001 likewise. And about the discussion, I like to encourage many more clinical trials on hyperlipidemia using this colostrinum 6X. And only limited number of studies have been done regarding colostrinum. And I have chosen only male rats. And this was the limitation of my study, because as a student, I cannot afford that much number of rats. And as a final year student, I cannot get the permission of more rats to be used. Then the conclusion, this is an in vivo study on hyperlipidemia conducted on high-fat diet-induced 12 Western albino rats, and the rats were high-fat fed, and they were divided into experimental group and control group having 6 rats each. Then the control group were non-medicated, and the experimental group was given colostrinum 6X, and results were confirmed using paired samples test analysis. Then I'm concluding, and my acknowledgements to Sharda Krishna Homeopathic Medical College and the staffs, and Daleview College for providing me for conducting the research, and special thanks to Father Muller Homeopathic Medical College for accepting my presentation. Thank you.
Thank you, Ms. Arsha George. Judges, please note the time taken by the presenter is 4 minutes and 40 seconds. Now I would like to invite
Yes, sir.
appreciable, but my question comes to you, why it was done on rat and why not on a human being?
Because in
Because collateral is very well known and produce a positive effect on the human being also. It has been widely and widely, both it has been used to control the lipidemia.
So that was because in my college, that is this is a 2-month study. So within 2 months study, I cannot afford that much cases. And especially I had a personal interest on studying on rats. That's why I have chosen rats.
Continuing with what sir told, the rationale behind the study, no, the novelty. Why you choose this topic? If
That's
yeah.
because I already told sir, due to the increasing incidence of cardiovascular disease, there is a higher chance of that is due to increased level of hyperlipidemia. That's why I have taken this topic.
Okay, if sufficient, suppose there are research available on human beings,
Pardon, sir.
what makes us to do animal study? If data are available with human beings, is there a necessity to go back and do similar animal study? That is the question. What we are
So that's because within these 2 months I cannot get this much cases, and that's
okay,
why I have to.
fine, but that's not a valid reason. When there are human data, we don't have to go back to animals and do the similar studies.
Okay, sir.
But your study is good. We are not telling that.
Okay, sir.
Go back your results.
Okay, sir.
Yeah, experimental group.
Yes.
Did you take an average of this? Did some analysis for comparing?
Yes, sir. I have done paired samples tester.
Hmm.
Only one thing for my knowledge, does the rate have the same level and the same level of lipids? I don't know. Actually, I don't know because when we talk, human being have a 200. What is the normal parameters in rats?
Yes, sir. For considering rats also, there is this normal parameters like that of humans. That's why I have taken visitor rats. They have physiological and anatomical relation to human beings, sir.
Almost same. What about HDL here?
Yes, in this study, I have noted that HDL also got reduced, and that's why
What was the HDL before?
HDL was a normal, sir. But in this case, HDL also got reduced.
See, you should have taken the average value, no, HDL.
Yes, sir.
Before giving the homeopathic medication, what was the HDL value in the experimental group?
Yes, sir.
HDL 60, 65, 70, all these things.
Yes, sir.
Can you tell me something about HDL? Is it a good one? What is the role?
Yes, sir. HDL is actually good cholesterol. And here in this study, HDL value also got reduced. That's why I suggested that more clinical studies is needed in this drug.
Yeah, this is debatable because clinical studies might have been already done.
Yes, sir.
You have to thoroughly look into the literature about this.
Yes, sir.
Okay, then you will be able to get a valid findings. And going back to your exclusion criteria, once you say you have taken male rats, there is no need to tell female rats are excluded.
Yes, sir.
See, generally when you write exclusion, among those you include whom you want to exclude. That has to come.
Okay, sir.
Understood, no?
Yes, sir.
Yeah, I saw some other people also. 18 to 35 years included. Then they say less than 18 is excluded, more than 35 is excluded. No need to mention. It is understood. Among those whom you want to exclude, that you have to write in exclusion criteria.
Okay, sir.
Okay.
Okay, sir.
Anyway, it's a good effort. Good
Thanks.
effort.
Hi, Arsha.
Hello, ma'am.
Nice topic. But are there any previous studies done in the similar manner?
Pardon me, ma'am.
Did you come across any previous studies done in the similar manner?
Ma'am, only limited number of studies are there. I have seen 2 studies, and only one study was conducted on colostrum in 6x potency, and another study was done on monkeys, and no confirmation of results were there.
Did you come across any papers in which human participants were included instead of?
Yeah, ma'am. One paper is there, one clinical study is there, and that was also conducted on colostrum 3x.
And what are the study limitations?
And here I have used only 12 rats, and then I have chosen only male rats, and only a 2 month study is this. We need to have more time for doing this kind of studies.
And did you obtain any ethical clearance for using rats in your study? No?
And I don't understand, ma'am.
Any ethics committee clearance?
Yes, ma'am. I have got acceptance from Animal Ethical Clearance Committee, ma'am.
Okay. So how many rats did they allot? How many rats did they allot?
12 rats, ma'am. Only 12 rats.
12 rats.
Yes, ma'am.
Okay, all the best.
Thank you, ma'am.
Now, I would like to invite Ms. Ajiba Fatima S. to come to the dais.
A very good afternoon, everyone.
Presenter, your time starts now.
A very good afternoon, everyone. I am S. Ajiba Fatima from Sri Bharani Homeopathy Medical College. First, I'd like to thank Potentia and Father Muller Homeopathy Medical College for providing me this wonderful opportunity. So, today I am here to present my research study on homeopathic interventions for non-metastatic breast cancers, clinical outcomes and implications. So, before I present my study, I'd like to put a thought into your minds. What is a cancer to homeopath? Can us homeopaths treat cancer? As we all know, breast cancer is the most prevalent global health issues recently, and it has caused more than lakhs of deaths in this recent years. So, how does breast cancer is caused? Breast cancer occurs when normal breast cells are transformed abnormally and grows out of control, which further leads to metastasis and causes life-threatening situations. So the risk factor includes family history, obesity, reproductive history, and age factors. So various treatment in the conventional treatments are surgery with radiation therapy, chemotherapy, stem cell therapy, etc. This study is to evaluate the effectiveness of homeopathy on treating the patients with non-metastatic breast cancer by using the remedies after the diagnosis. The aim of this study is to evaluate the effectiveness of homeopathy on treating the patients with non-metastatic breast cancers, and the objective is to first investigate about the effectiveness impact of homeopathic treatment encompassing the social, physical and mental well-being of the patient, and also to know the difference between the conventional treatment and homeopathic treatments. So the methods and protocol opted for this study are single subject experimental design focused on one female patient, Mrs. Meenakshi, 48 years old, diagnosed with non-metastatic breast cancer. The duration opted for this study is 12 months and it is a longitudinal study. The subject is selected from the OPD of Sri Bharani Homeopathy Medical College. The informed consent was taken from the patient, explaining the research procedure in the vernacular language before involving them in the study. So in this study, the patient presented with left breast palpable lump, pain, and there is no nipple discharge. On examining, the lump is 4.4 centimeters at 3 o'clock position. 4.4 centimeter at 3 o'clock position. The skin is normal. There is mobility of the lump. A left axillary node is involved. No supraclavicular lymph node involvement. The right breast is normal. So the treatment planned opted is pathology-based treatment. The treatment is selected based on the patient-specific symptoms through different approaches like individualization and miasmatic approach. So the follow-ups were sessioned on the basis of every week. For the introduction of new remedies if necessary. The inclusion and exclusion criteria. The inclusion criteria includes female patient because 1 in 8 female in this world are diagnosed with breast cancer in their lifetime, and 1 in thousands of males are only diagnosed with the breast cancer. So the inclusion criteria includes female patient, confirmed diagnosis with non-metastatic breast cancer, that is stage 1 and stage 2, the willingness to adhere to homeopathic treatment, no other concurrent chemotherapy is opted. The exclusion criteria includes metastatic breast cancer, comorbid conditions like cardiovascular systems, and they are planning to receive other conventional treatments. So first outcomes, the outcomes expected in the studies are The reduction of breast cancer symptoms such as pain, fatigue, reduction in the lump, improvement in the energy level and emotional stability of the patient. The secondary outcomes are enhanced functioning and participation in social activities, reduced anxiety and depression level for the patient. Economic affordability of the treatment is also focused in the study. So the evaluation measures are to know the quality of life. We included the questionnaires to at the base of treatment, mid of the treatment, and end of the treatment. And the psychological assessments questionnaire is also administered to the patient. And clinical assessment is also done in the monthly basis through blood tests, immune markers, and imaging studies like mammograms. The data collection was through the graphical representation, the surveys, laboratory tests. Data analysis was represented in the graphical chart, which shows the reduction of pain scale from 8 to 0 or 8 to 1. The tumor sizes or the reduction of tumor size is also seen. This treatment was opted on the basis of similia similipus curanter. The key findings in this results are the significant reduce in tumor size, the reduction in pain. Before and after mammogram findings is also represented. Before, there is a hyperplastic lesion in the mammogram. After the treatment of 1 year, there is no hyperplastic lesions in the skin, in the left breast. So PET scan is also dated on after 1 year of the treatment. These findings open a new avenue for researchers, particularly in integrating homeopathy with conventional treatments and exploring its mechanism and action. This study provides valuable insight in efficacy of homeopathic treatment for the breast cancer, enhancing our understanding of its potential role in managing and curing the disease. So some important remedies for this is Conea metallicum, Phycolacta decandra, Strychnum, Bryonia alba, Medorinum, and Belladonna. These kind of important remedies are apted in this study, but the remedies are selected only on the basis of patient-specific symptoms, including mental, physical, and pathological symptoms. Not every patient have a similar same remedy. It should be selected on the basis of patient. The key findings in this research are it indicates classical homeopathic treatments can provide symptomatic cure and improve the quality of life of patients with non-metastatic breast cancer. The clinical data showed reduction in size of tumor. Patient reported with outcome demonstrated enhanced physical and emotional well-being. These findings suggest the homeopathic treatment could be considered as an approach of holistic management in non-metastatic breast cancer. This may lead to integration of homeopathy in standard cancer protocols. I'd like to acknowledge my guide, Dr. V. Karthikeyan sir, Assistant Professor of Materia Medica Department, for guiding me all through this way. And I would like to thank my parents for taking me along.
Thank you, Ms. Ajiba. Judges, please note the time taken by the presenter is 7 minutes 15 seconds.
Hi, Ajiba.
Hello,
Nice
ma'am.
presentation.
Thank you, ma'am.
Can you tell me the type of the study? What type of research is this?
This is a single subject experimental research, ma'am. It is clinical study type
No, it's a case report.
case report.
Okay, so that's the terminology you should use for such reports when you present, okay? And the second thing is never reveal the personal details of the patient when you present case reports. You told the name of the patient, from which OPD the patient took the treatment and things. So data privacy is very important, yeah? So when you include research participants into a study, in the informed consent form, you need to also ensure how much privacy and confidentiality will be respected and how much you will protect it. That's very important. So never reveal the name of the patient, the age of the patient, any personal identification through which anybody can identify the patient. Okay? Because some diseases are associated with stigma. Yeah, because some patients, when they take a treatment for cancer, sometimes the family is not aware that they're diagnosed with cancer, especially when it is non-metastatic. It can be a secret. Okay, so do not reveal these details. Other than that, fine. Thank you.
Okay, ma'am. Thank you, sir.
Next, I would like to call Mr. K.S. Dhanishraman upon the stage. Presenter, your time starts now.
Good afternoon to all. I am K.S. Dhanusraman, third year student from Sri Bharani Homeopathy Medical College. My topic: treat infertility through homeopathy. Introduction. Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility is a global health issue affecting millions of people of reproductive age of worldwide. Both male and females are affected with infertility. Homeopathic medicine is helpful in treating the infertility. My aim and objects: treating an infertility case through homeopathy. 10 to 15% of couples are affected by infertility due to various factors. Most of the couples are mentally affected, which are later manifested as a symptom of infertility. Based on constitutional medicine, infertility can be treated by homeopathy. Methods. This case history is obtained from the my college OPD. Case history: Mr. Karthikeyan and Mrs. Santini of age of 40 and 30 came with a complaint of infertility on 25/8/2023. OP number is 10081 and 10082. They had visited multiple allopathy hospital for their treatment for the past 10 years, but there is no positive result. I analyzed the seminal count of patient was total sperm count is 1.5 milliliter. Active motile is 30%, sluggish motile 20%, non-motile 50%. The results showed that the patient was suffering from azoospermia for the past 10 years. And Mr. Santi also found to the decreased follicular stimulating hormone level on analysis. Both are given homeopathic treatment for 6 months, and the medicine was given based on their constitution, proper diet and maintained along with the medicine. And evaluation after complete case taking, the patient was treated based on their constitution by homeopathic medicine. And lab report semen analysis are on 25 before treatment 1.5 ml, motility is 30%, total sperm count 30%. After homeopathic treatment, motility is 60%. And same as Mrs. Santi, before treatment FHS hormones 4.0 ml, and after treatment is 8.0 ml. Result: after 6 months of continuous homeopathic treatment, the sperm motility is increased by 30% with increased sperm count, and Mrs. Santi's FHS hormones increased. Finally, after 7 months of homeopathic treatment, Mrs. Santi has got conceived on March 5, 2024. Discussion: homeopathy system of medicine helpful curing infertility. There is no need for any surgical method of treatment. Constitutional remedies act well in this case. End of lab reports: the sperm count increase in 6 months. Sperm motility is up to 60%. Hormone level is increased. Hence, homeopathic system of medicine is effective in treatment infertility. I cannot express enough thanks to my guest, Dr. B. Karthikeyan, MD, Homeo, Associate Professor, Department of Homeopathic Medicine. Thank you.
Thank you, Mr. Dhanishraman. Judges, please note the time taken by the presenter is 3 minutes and 51 seconds.
Encouraging result, but this is in a one case, one couple. In what way you can triplicate this type of result? Because causes of infertility is varied, right? Yeah. So what way this research can be taken further?
Sir,
Have you understood the question?
no, sir.
So, because this is a one couple you have treated, right, successfully. Suppose you would like to duplicate this result in number of other infertility couples, or you would like to go at the research level. What are the things that you will keep in mind?
I will help you. You did one case report now, one couple, that's all. That's enough? Or you want to do a future study on this?
No, sir.
So if you want to do a future study, how you will do?
Many couples, sir.
That means you have to calculate sample size, you have to take good number of participants, interventional studies you have to do.
Okay, sir.
That is the message from us. Okay, and your discussion and all there, okay, this homeopathy treatment was effective for this couple, that's fine. Don't make other claims that no need of surgery and all those general statements you avoid. Okay, stick on to what you have got. Was it effective? Good enough. Go back to your discussion. I'll just show you one or two. Yeah, the second sentence, all those things. You try to avoid that. You don't know. See, with respect to the case, what you have got beneficial results. That is good enough. What needs to be done in future, you tell that. Other things you don't mix up. And as madam already told, name, OP number, IP number, all these things we should avoid. You can give a code number and say a couple came and got it.
Thank you, sir.
Hi, Dharishraman.
Hi, ma'am.
Yeah. You're a beginner in research, so it's okay if you don't know what to do next. No problem, but there's always scope for improvement and to learn new things. Yeah. So what you have presented today is a case report.
Yes.
So when you present a case report, now here you don't have any literature review, you do not have any previous studies to show. So the data when you present is always questionable. Like when you say, I got this result, how did you get, when did you get, how much did you get, why did you get? Many questions come up when you present case reports. So to avoid that, it's always a good idea to present your lab reports with the details of the patients hidden. So you can show on in the month of July, these were the parameters. In August, these were the parameters. Then after 4 months, this was the endpoint. Okay, and whatever examinations and things to do, everything should be recorded in the case record form. So those reports you can present.
Okay.
Yeah. All the best.
Thank you.
For the next presentation, I request Ms. Ashira Banu to kindly come on stage. Presenter, your time starts now.
Distinguished luminaries, venerable stakers, and illustrating gatherings of esteemed individuals, it is my profound privilege to announce my own presence upon this hallowed stage. I, Ashira Banu Barkatullah, student 3rd BHMS of Sri Bharani Homeopathy Medical College, a paragon of Oration, a virtuoso of verbosity, and a sultan of sophistication, shall regale and edify you with the tempest of words woven from the fabric of brilliance itself. Prepare to be transported to a realm of wonder, and the next 7 minutes unfold like a lotus flower blooming in the gardens of knowledge. So, let me go into my topic. Efficiency of homeopathic medicines in osteoarthritis will elem potency. Please don't get bored that osteoarthritis has been proved by many members, but I have taken a specificity that I am going to present it on LM potency. Introduction. Osteoarthritis is one of the most commonest type of chronic degenerative disease and disabling disease characterized by complex disorders of whole synovial joints, including structural defects of hyaline articular cartilage. In 2021, less than 22% of adults older than 40 had knee OA, and it is esteemed that over 500 million individuals are currently affected with OA worldwide. Lacking long-term clinical treatment, OA patients at the end stage of the disease are ultimately subjected to joint replacement surgery, which is really pity condition. Joint replacement surgery is growing at a rate of 10 per year globally, and 95% is performed for OA patients. However, the lifespan of artificial joints is limited and the risk of poor outcome exists. By 2020, OA is globally esteemed to be the fourth leading cause of disability, with a huge amount of medical healthcare costs and indirect costs caused by loss of jobs and early retirement. To make a management in joint pain with 0% side effect with homeopathic treatment. And my aim and objective to study the effectiveness of homeopathic medicine in patients with osteoarthritis, to find out the effectiveness of homeopathic medicine in relieving symptoms, thereby curing the condition, to find out the effectiveness of constitutional medicine and intercurrent medicine in prevailing recurrence, to find out the efficiency between before and after treatment in management of osteoarthritis. Methods. There are various methods used for treating OA. The alternative methods which major people choose are knee replacement therapy, physiotherapy, minor exercises, duct therapy, corticosteroid injection, hyaluron injection, etc. But all this can be considered as a supportive way. The management is found in homeopathy in a harmless way. The protocol used is the person have been treated based on homeopathic principle with exact simillimum for the management of OA added by Master Samuel Hahnemann. Similia similibus curenter. The classical method of prescription has been used in my successful observed cases. According to my observations, there are certain remedies which play a role for cure. Those are Bryonia alba, Calcarea carp, Calcarea pos, Lachesis, Lycopodium, Rustox, Sulfur, Medorinum, Formica rufa, and Colchicum atom. But don't consider only these medicines can play a role on OA, but these medicines are selected based on pathological changes and their constitution. I have approximately found 99% successful cases of OA joint from homeopathical classical treatment from my college OPD. An impressive case has been presented now with a drastic change. The case presented here is by the concern of the patient. Mrs. X with the OP number 14117 had presenting complaints of bilateral knee joint which aggravated on working. Any movement felt better rest. She had an occupational history with obesity and family history. The case was treated with LM potency with single medicine and found better management for her pain. On my observations, the result can be said that patient took proper exercise and diet with regimen advised by the doctor and feels better now. The X-ray copy of before and after treatment has been attached here. The way of prescription was truly based on pathological mode. So many cases of OA has been treated in my college OPD, and I have made clear observations that homeopathy medicine acts on degenerative disease and gives them relief from pain in a harmless, simple, easy way. The result, the laboratory investigation of the case has been attached here as a proof of homeopathic cure. Before the treatment, you can see the synovial space, and after treatment, you can see the normal knee joint. The previous X-ray shows how homeopathy truly acts on degenerative bone disease compared with other mode of treatment plan. Homeopathy is simple and easy way of cure and management. Discussion. In incidence, according to 2017 Global Burden of Disease Study, about 14.9 million incident cases of OA were reported globally with an 8 standardized incident rate of 81.2% per 100% per year, an increase of 8.2% from 1990 to 2017. Basic causes of OA are aging,
being overweighted, that is obesity, history of injury or surgery to a joint, overuse from repetitive movements of the joint that do not perform correctly, family history of osteoarthritis. So, based on the management criteria, homeopathic mode is well effective in reducing the pain with sorrow. Conclusion. According to my observation, I conclude presentation by saying that selection of a correct simulacrum for any case by evaluation of totality of symptoms give better relief for the affections. Acknowledgement. I cannot express enough thanks to my guide, Dr. V. Karthikeyan, for his unconditional support. I also thank my parents and Sri Barani Homeopathy Medical College for giving me the platform, and thank you Potentia 24 and Father Muller Homeopathic Medical College for this slide. Thank you.
Thank you, Ms. Ashira. Judges, please note the time taken by the presenter is 7 minutes 25 seconds.
So, Ashira, congratulations, you are like rain. Who would like to share your knowledge? The few important points when you suggest that 92% of cases improved with homeopathy, which grade of osteoarthritis you have taken?
Sir, in osteoarthritis, there are several grades. Primary, secondary osteoarthritis, and the tertiary and final stage, which is really very hard. But I have taken secondary grade. And the patient, the particular case which I have presented was mainly based on occupational history, and this was a second grade of deformity, sir.
Because when you say the all type of osteoarthritis improve with homeopathy, I think it's a really remarkable, but the experiences are something different. First thing. Second, go to the method. Go to the slide of method. Yeah. Why the physiotherapy has been used as a, because it is a auxiliary management. Physiotherapy, except the knee transplantation and the drug therapy, other can be very well helpful for the homeopathy. Why you are writing like this?
Sir, there are several methods that can be.
Physiotherapy is always helpful. That is the first important thing. Second, I was not able to understand at certain moment, certain time you have used the word constitutional. Then the certain time you have used the pathological. So do I understand any difference between both?
Sir, the main concentration I gave on pathological symptoms, sir, but the list of drugs I have shown here was based on particular patients also, sir. But maximum the symptoms I obtained, and the prescription made, and the prescription was made by my doctors, but I have made the observations from them, that's also. Based on pathological mode is the maximum, sir.
Both have a different connotation when you talk of a pathological prescription and when you talk of a constitutional prescription. And finally, the X-ray which you have shown, do I understand the regenerative process has gone into the regenerative phase? Because there was absolutely degenerative changes in the first X-ray. Second, the gap was not there. Go to the X-ray, yeah. Because one X-ray is absolutely normal, another where there are a major osteoarthritis changes are there. Even if I can say spikes are also there and the other thing. There is no space. So do I understand homeopathy have taken care of degenerative and going into the regenerative phase, so the space become a normal?
By taking homeopathy treatment, it can be normal.
See, there is a way how a case report has to be narrated.
Yes.
And in the method section, don't write what are the other treatments like an introduction. That has to come in introduction somewhere where you justify why homeopathy has to be done. There you can include those sentences with the references. But as you go on in methods, what is done you have to write.
Okay, sir.
So case report narration has a proper format. You please look into that. And somewhere I saw in result or discussion somewhere that in 99% of the cases, in my experience,
In my observations,
my observations, it is better not to claim in a case report presentation. That is okay for senior practitioners when they give an oration or give a talk, because with their rich experience, they would tell all those things. But yours is limited to one case report or one particular study. So don't narrate, put such sentences that in my experience or my observation of 99% cases, please don't put in your this one studies, okay?
Okay, sir.
Yeah, otherwise it's good study.
Thank you, sir.
Hi, Shira.
definitely.
Nice presentation, but please take care of these things, what both judges have said. No comments from my side. All the best.
Okay, thank you, ma'am.
For the last presentation of the day, I request Ms. Krishna Shri to come on the stage. Presenter, your time starts now.
Good afternoon, one and all present here. My name is Krishna Shri. I'm from Bharatiya Homeopathic Medical College. My voice is better than this. For now, I'm suffering from sore throat. And thank you so much for the management. They have rescheduled my presentation. Actually, it was third presentation. They've given me opportunity to cope up. Thank you so much, ma'am. So my title here is Miasmatic Interpretation of hydrocele. Introduction. The study explores various textbooks of organon and even pathophysiological references. And my major study is derived from organon textbook, that is Chronic Miasm by Dr. Samuel Hahnemann, Chronic Miasms by J.H. Allen. My aim is to study the interpretation of miasm, that is the expression of the miasm, and effectiveness of homeopathic remedies prescribed on the basis of miasmatic expression. So, coming back to the basics, starting from basic, what is miasm? Miasm is the cause for any given condition, any given disease. And Dr. Hahnemann classifies these miasms into two groups, ventral one and the non-ventral one. The non-ventral one is sora, obviously, and the ventral one is psychosis and syphilis. So how do we get this ventral miasms? By pollutant sexual contact, we get the ventral miasms. So, coming to miasmatic interpretation of psychosis. Initially, an individual is affected by psychosis through gonorrheal infection, that is Neisseria gonorrhea bacteria, classical disease, and the manifestations are offensive discharges with particular fish brine odor and inflammation of the genitals and so on and so forth. Now, if this classical gonorrhea is not treated homeopathically by following principles of homeopathy, then it gets suppressed, and then it gets evolved into primary, secondary, and tertiary forms. Through suppression, we get these primary, secondary, tertiary manifestations. And in primary, secondary manifestations, we see inflammations that are particularly specifically affecting the genitals of male genitals like kidneys, scrotum, our ureters, urethra, and in female pelvis area, which includes endometrium, ovaries, our fallopian tubes leading to ovaritis, salpingitis are certain examples and manifestations of primary, secondary psychotic expressions. And it also involves gouty forms, rheumatisms, appendicitis, and adhesions. And in tertiary form, there is major like malignancies, inflammatory malignancies, lupus, tumors, etc. Now, coming to the major part, how to interpret a particular miasm, how to interpret psychotic miasm in a given condition. Through Phillips Pite, through J. Chellen, and through chronic miasm, I have gathered these points. That is basically a literature review. Lesions in congenital conditions usually have stunted growth. For example, hydrocele, like it is a interpretation done on hydrocele. Pathophysiological references depict that in congenital form, the tunica vaginalis is not developed, underdeveloped, stunted growth is seen. So this is one expression that I have derived from my review. And second one is accumulation and overgrowth. Now see, we cannot interpret one miasm just by one particular expression, like see, like very general, like psychosis means overgrowth, hyper things. No, we need certain symptom picture. And like this is a symptom picture of psychosis, which I have derived for now. Accumulation and overgrowth. All the manifestations are accompanied by hyper in their expressions. Hyper means hypertrophy, hyperplasia. These all pathologies are involved in psychotic manifestations. Definitive feature of psychosis is its persistence and positiveness towards the disease. How to actually differentiate between psychosis and syphilis is syphilis, it does not have this positiveness and persistence in its disease course. But in psychosis, we can see that means even after attempting, there will be relapse of the disease. This is the fundamental idea behind this expression. So this is one case. This is one case of hydrocele. I'm just going to interpret it in hydrocele how I've taken out psychotic expressions. In my college hospital, 4-year-old child walked with scrotal swelling, right-sided scrotal swelling, and on diagnosis, we found out that there is hydrocele. Now, after extensive case taking, we found out that his grandfather and grandfather's brother also had this hydrocele. And now, however, interpreted this particular miasm in hydrocele is, according to the miasmatic expression of the case, genitals are affected. As I've told you all, usually the genitals are affected in psychotic manifestations. Secondly, history, that is family history. This is very important. This venereal miasm, psychosis, syphilis, even SORA, can be inherited. Okay, through Mendel's law, the basic Mendel's law speaks the dominant gene can be inherited from the parents to the offsprings. So that through that idea, if the father or grandfather is suffering from psychosis, this has been inherited to the child, to this 4-year-old kid, to the child, and hereditary transmission of the expression is seen. So like this, I would like to conclude that hydrocele is a condition that occurs due to suppression of psychosis, be it primary, secondary, tertiary suppression. And yeah, in this particular case, it is a congenital case, and it has been inherited from their parents, grandparents. Results. Now, what is the major result now after actually interpreting what I have? The result is we can beautifully design therapeutic strategies, easier, efficient therapeutic strategies. Like based on miasms, we can divide these therapeutics from external cause, internal cause. The remedies differ. So if we understand the cause of the disease, therapeutic strategies become much more easier. By recognizing the underlying miasm, a homeopathic practitioner can adopt to the treatment that targets the root cause of the suffering individual. Thank you so much to my guide, Sagar Patil sir. He supported me. Thank you so much to my college, Bhartish Institute. And to be really honest, today actually the management of this college helped me. I'm suffering so much. Thank you so much, Razia ma'am. Thank you.
Thank you, Ms. Krishnashri. Judges, please note the time taken by the presenter is 7 minutes 45 seconds.
topic was definitely interesting. But what happened from theory, the understanding of Mahism, when we try to extend from Hahnemannian concept, we have to go to the pathophysiology of a hydrocele. And that was a, if you can add that, what actually occur in cases of development of a hydrocele, what are the changes taken place at the level of structure, right? And the function which altered, that can give a more highlight, and you can able to correlate more in a much better way with the concept of Mahism. And that I definitely, because you have focus on the genetical, or you have talk on the hereditary, right? But the further interpretation required to do in a light of a pathophysiology of a hydrocele. Okay, it's a good thing. Go ahead, because you're required to work. Thank you.
Sir, about that about the pathophysiology, I wanted to speak. It is my drawback, my limitation today. Thank you so much.
Now I invite Ms. Nishita for their feedback.
Good afternoon, everyone. I am Nishchita from Alva's Homeopathic Medical College. So, basically, when Alvas meet Father Mullers, there is a special sort of hospitality and comfort we get here. Whether it might be Potentia or whatever, but when Alvas meet Father Mullers, it is a special sort of care we get. So, same thing I've experienced today also, right from the reception desk till the MC desk also, and all special mention to the judges, because whatever the words we have got through the judges, this gives a breakaway for a new way to the young researchers like us. So many more potentials to come, because since 2 years I used to attend Potentia as a delegate, but from last year we have attended the Potentia as a participants. So many more potentials to come in my life too. So at the same time, I would like to thank the whole Potentia team of Father Muller's Homeopathic Medical College for providing us this opportunity to put on our thoughts and research projects on this platform. Thank you so much.
Thank you, Nishita. I also invite Ms. Hetwi for their feedback.
Good afternoon, all. I'm Hetvi Kunchla from Rajkot Homeopathic Medical College. So this was my first time ever in Potentia and first time coming out from my state to another to present a research paper. And it was a wonderful experience. I have to really thank Potentia, the organizers. The hospitality was really good. Everything was really managed well, and I felt really comfortable. And I would really encourage my juniors and my fellows to do participate and to attend Potentia for further knowledge. This was really encouraging for upcoming researchers and students like me also. So thank you, Father Muller Homeopathic Medical College. Thank you, everyone.
Thank you, Hetwi. Next, I invite Ms. Shweta Srivarma for their feedback.
Once again, good afternoon, everyone. I firstly congratulate Potentia team for organizing this very effective Potentia event. And from coming from the registration process, it is very easy and comforting. So everyone would understand and do the process. And I appreciate that you all gave guidelines for abstract and template